A client is scheduled for avoiding cystogram, which nursing intervention would be essential to carry out several hours before the test. 1. Maintaining NPO status. 2. Medicating with urinary antiseptics. 3. Administering bowel preparation. 4. Forcing fluids. A client's laboratory results have been returned and the creatinine level is 7 mg per deciliter. This finding would lead the nurse to place the highest priority on assessing 1. Temperature. 2. Intake and output. 3. Capillary refill. 4. Pupillary reflex. The most appropriate nursing intervention, based on physician's orders, for treating metabolic acidosis is to 1. Replace potassium ions immediately to prevent hypokalemia. 2. Administer oral sodium bicarbonate to act as a buffer. 3. Administer IV catecholamines, Levift, to prevent hypotension. 4. Administer fluids to prevent dehydration. A retention catheter for a male client is correctly taped if it is 1. On the upper thigh. 2. On the umbilicus. 3. Under the thigh. 4. On the inner thigh. When the client is lying supine, the nurse will prevent external rotation of the lower extremity by using a 1. Trochanter roll by the knee. 2. Sandbag to the lateral calf. 3. Trochanter roll to the thigh. 4. Footboard. One method of assessing for signs of circulatory impairment in a client with a fractured femur is to ask the client to 1. Cough and deep breathe. 2. Turn himself in bed. 3. Perform biceps exercises. 4. Wiggle his toes. When a client has cervical halter traction to immobilize the cervical spine, counter traction is provided by 1. Elevating the foot of the bed. 2. Elevating the head of the bed. 3. Application of the pelvic girdle. 4. Lowering the head of the bed. A client's physician orders a Charnley pillow, wedge. The nurse understands that the purpose of using this type of pillow is to 1. Support the ball and socket joint. 2. Maintain abduction. 3. Maintain adduction. 4. Encourage internal rotation of the hips. When a client has suffered severe burns all over his body, the most effective method of monitoring the cardiovascular system is 1. Cuff blood pressure. 2. Arterial pressure. 3. Central venous pressure. 4. Pulmonary artery pressure. A client sustains a 30% burn over her lower extremities. When she arrives in the emergency room, the most important intervention is to 1. Clean and dress the wound. 2. Immediately perform endotracheal intubation. 3. Administer a tetanus booster. 4. Start an IV. Monitoring the client's skin condition involves several specific nursing actions. Which action would be the least important? 1. Check the skin color. 2. Assess the skin temperature. 3. Observe skin turgor. 4. Examine skin for dryness. The client has orders to draw blood for serum electrolytes. She is on bed rest and has an IV in the basilic vein of the right forearm. The most appropriate site for blood withdrawal is the 1. Left upper arm, brachial vein. 2. Right forearm, radial vein. 3. Foot, greater saphenous vein. 4. Left forearm, median cubital vein. When a client with a high fever and a diagnosis of viral infection is admitted to the hospital, the nurse would expect the lymphocyte T-cell count to be 1. Higher than normal. 2. Lower than normal. 3. Within normal limits. 4. Absent. A client has lost about 30% of his total blood volume. Blood has been replaced, but his blood pressure remains low. Which of the following drugs would the nurse anticipate the physician's ordering? 1. A vasopressor. 2. A vasodilator. 3. An adrenergic blocking drug. 4. A parasympathetic drug. The type 2 diabetic who is obese is best controlled by weight loss because obesity 1. Reduces the number of insulin receptors. 2. Causes pancreatic islet cell exhaustion. 3. Reduces insulin binding at receptor sites. 4. Reduces pancreatic insulin production. The client with hyperparathyroidism should have extremities handled gently because 1. Decreased calcium bone deposits can lead to pathologic fractures. 2. Edema causes stretched tissue to tear easily. 3. Hypertension can lead to a stroke with residual paralysis. 4. Polyuria leads to dry skin and mucous membranes that can break down. Which of the following nursing diagnoses would be most appropriate for the client with decreased thyroid function? 1. Alteration in growth and development related to increased growth hormone production. 2. Alteration in thought processes related to decreased neurologic function. 3. Fluid volume deficit related to polyuria. 4. Hypothermia related to decreased metabolic rate. Evaluating the effectiveness of preoperative teaching before colostomy surgery, the nurse expects that the client will be able to 1. Describe how the procedure will be done. 2. Exhibit acceptance of the surgery. 3. Explain the function of the colostomy. 4. Apply the colostomy bag correctly. A client scheduled for surgery is given a spinal anesthetic. Immediately following the injection, the nurse will position the client 1. On his abdomen. 2. In semi-Fowler's position. 3. In slight Trendelenburg position. 4. On his back or side with head raised. Following spinal anesthesia, a client is brought into the post-anesthesia unit. The assessment data that indicate a complication of anesthesia has developed include 1. Hiccups. 2. Numbness in legs. 3. Headache. 4. No urge to void.